Hello everyone. So today we are going to talk about allergic rhinitis from my book The Resident Physician. So this is the topic, allergic rhinitis. Let us explain this allergic rhinitis in detail here in this page and the treatment of it. So allergic rhinitis उर्दू में हम इसको कहते हैं नाक की एलर्जी. The clinical features are forced nasal drip, nasal stiffness, nasal congestion, recurrent sore throat, headache and cough. The forced nasal drip from the back side of the nose, the mucus is going to drift into the throat and they irritate the throat, because of which the patient will complain of cough, and because of that also there will be recurrent sore throat infection and the sinuses will be blocked. That will be lead to congestion, and because of that congestion the patient will also having a headache. So now let us talk about the treatment. We will give the different coverage. We will give the nasal steroid spray, nasal steroids, and then oral, and then cough syrup, then anti-allergic decongestion, then something so which can decrease the bronchospasm, and then about the diet. So the nasal spray, we will give beclomethasone dipropionate, which available on the brand name rhinoclinil nasal spray. So here is the rhinoclinil nasal spray. We will put the two drops from it in each nostril before the sleep, I mean at night. If the condition is severe, we can advise it for at least 3 months. And then another spray which we can also use, that is mometasone furoate, which is come under the brand name high weight nasal spray. So any of it advise rhinoclinil or high weight. Now we will also give the oral steroid because this is the allergy, so we will also give the oral steroid prednisolone, which is come under the Delta Cartel brand name, 5 mg, 2 tablet at morning, 2 tablet at evening for 10 days. Then we will because maybe the patient will having from the forced nasal drip, the patient may having a complaint of cough, so you can advise any cough syrup and give 2 teaspoons as needed. Another thing which we will give antihistamine or anti-allergic and decongestion. We will give the deslorotadine, which also having anti-allergic and decongestion activities, 5 mg, which come under the brand name Jordan D. So this is deslorotadine. The deslorotadine 5 mg, 1 tablet at night for at least 10 days. Then to decrease the bronchospasm, we will advise Montelukast 10 mg, which is come under the brand name Montica, 1 tablet at night for at least 2 to 3 months. And when we are giving the oral steroid, we will also give the stomach coverage PPI. So we can advise any PPI, esomeprazole, omeprazole, or any. Here is an example: 40 mg, 1 UD at morning before breakfast. We will also advise the patient to drink plenty of water, avoid oily food, 2 cups of vegetable and 1 cup of fruits. And in the home remedies, there is what we call nasal saline. Put 1 teaspoon in 1 glass of water and wash your nose with it. This is what we call nasal saline. Another thing, we can apply this Vaseline inside the nasal mucosa, and because the allergic rhinitis, most probably because of the pollen or allergen which come when we are taking the breath, it come into the nose and it irritate and it cause allergic rhinitis. So if you put the Vaseline inside the nose, then these dust and pollen can stuck in it. So we can also use a little amount of Vaseline also. And another, honey, we can use 1 teaspoon of honey at night before sleep. So this is the treatment of allergic rhinitis. And we can also advise Influvac vaccine, which mostly which is intramuscular, and mostly we advise it to the patient on October or November month. So 1 Influvac vaccine yearly once.